Folks, thanks for coming on with us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 50 to 60 minutes or so discussing a roadmap on selling Medicare supplements. Today's presentation is being recorded, and it, along with much of the information that we reference through the course of the presentation, will be sent to all who have RSVP'd for today's meeting. That follow-up will also include the recording to this link, the recording link to this presentation, and should be sent to you within a day or so, depending upon how long it takes for the presentation recording to upload. A bit of housekeeping. You'll note in the software package for the webinar, there's a section for questions and chat. I ask that you use the questions section for your input and any questions you may have. You'll find that through the course of the presentation, we may answer those questions for you as part of it, but we will double check and make certain that your inquiries are satisfied, either by answering them right away or researching and sending that information to you as part of the follow-up. We will begin today's presentation with a bit of level set about our organization. For those of you who aren't as familiar with Premier Marketing, we are a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler working through independent agents such as yourself, offering contracts at the highest possible commission levels with recruiting contracts available to those who qualify. That program is executed through a full portfolio of insurance products that include the Medicare programs, the Medicare Advantage, Medicare Supplement, and standalone Part D programs, but also includes a portfolio of life insurance and annuity products, final expense life insurance, pre-need plans, long and short-term care programs, disability income and ancillary products such as dental, vision, hearing, critical illness, cancer, and hospital indemnity programs. When you look at the Medicare Advantage portfolio, it includes all the national carriers, including some additional regional carriers that might make a difference for you in your market. And that same philosophy carries over into the standalone prescription drug plans, where those PDP programs from the national carriers are available to you through our organization for your use. The Medicare Supplements, the topic for today, you see that we have a robust portfolio of those programs and specific marketing programs designed to help you succeed in this space, which is part of what we examine through today's presentation. When you look at the ancillary products in each of those categories, you have the national carriers there for you, the big boys in each of those categories, and you'll note that we've added an accident policy with Aflac and a program called MD Live that will be previewed in its entirety in an upcoming webinar here in the month of March. When you look at the Medicare market overall and you come on a program like today, people speak to you, like me, telling you about the silver tsunami, the aging of the baby boomers, 1 every 10 seconds, over 10,000 people a day. Well, if you look at the Medicare market based just on age, it's not a true number because there's a number of folks who are eligible for those benefits and don't take advantage of them when they're immediately eligible for one reason or another. And you'll find, too, that a good portion of the Medicare population is actually under the age of 65. So about a sixth to seventh of the Medicare population is under the age of 65. It's a special consideration when we speak to that regarding Medicare supplements because, well, they may be limited in their access to whatever type of supplement that they have available to them. But that is part of an overall demographic that we must address because these folks on Medicare have some challenges with their health. 2/3 of them have 3+ chronic conditions, and they have some challenges with their budget as well. So the average income of these folks nudging up to $26,120, I think, over the last number that I've seen on it. But the challenges with that budget and with their resources, that creates an opportunity for us to discuss multiple programs for them, but we also need to make certain that we are working with an individual who can afford the product that we are promoting, and that makes certain that we do a fair assessment of the Medicare possibilities for them and see what might be the best fit, because they have choices. When a person comes on Medicare, they could actually decline the Part B, the elective part, if they wanted to. Most don't. And some folks will just pick up a standalone Part D to help them with their prescription costs. However, we're finding that it's a pretty even split on folks who decide on sticking with traditional Medicare and picking up a standardized, modernized Medicare supplement like we'll discuss today. And then there's a portion of the population that opts into Medicare Part C, the Medicare Advantage programs, the all-in-one bundle that some people find a very viable alternative. This demonstrates from the information from depth research that tells us the split of the people who are coming into the plans upon their initial Medicare enrollment. Note that it's phrased that way because it talks about the age-ins and then, of course, the population that they refer to as late to Medicare seniors. So what we're seeing is Medicare Supplements is the primary enrollment choice as people come into Medicare by a couple of points over Medicare Advantage. We're seeing those numbers grow on both sides, but we also have a population that shows as Medicare only, original Medicare only. What's that mean? Well, it doesn't mean they don't have any additional coverage in some circumstances. They may be dual beneficiaries, folks who have both Medicare and Medicaid. They may be accessing benefits through the VA and feel additional coverage is not necessary. Or maybe group retirees in here as well. But there is a portion that has only Part A and B and possibly D, the drug programs, as they come into original Medicare. It's our obligation to reach as many people as possible to inform them of these choices, because in certain circumstances, if they don't pick an option, they'll be penalized for it, like the Part B plans, or they may have to undergo underwriting should they select a Medicare supplement program outside of a GI period, a guarantee issue period. So we want to make certain that we're addressing the population, not just the age-ins, but the people who are coming in late to Medicare, and then, of course, working with the folks who have made a choice to see if it's still the proper choice, the best choice for them based on some of their demographics, because it varies widely, and we need to make certain that we are getting them the information they need in order to select a program that may be best for them. Part of that is dealing with the language of Medicare. So part of the follow-up that you'll see with today's presentation is a link to a guide for the commonly used acronyms. It's a great tool for us to make certain that we are translating the language of Medicare for our prospects and clients. It's really easy to fall into the acronyms of, oh, you're an OEP, or hey, you have an SEP, or MOUSC, whatever the case may be. We want to make certain that the folks understand the message that we're putting through to them, and we have the facts on how to translate it as well. This is, of course, a tool that you can actually share with your prospects and clients as well, because it comes from Medicare and is a viable source of information that is compliant for you. The government also gives you additional tools that you can use to help translate the choices that people have, including the Medicare and You book, which we use each and every year, or a bit of Medicare Bible, but also they have some online pieces on YouTube that help you with the explanation of benefits if needed. And these are pieces that you can use with your prospects and clients. You've got a live link here to help you access that. Tons of different recordings like this. They're great pieces of information from the horse's mouth, so to speak. We need to look at some of the Medicare election periods, even though we are marketing Medicare supplements, because this gives us an opportunity to know if there is a prospect or a client that's on an MA program, and that program is no longer the most appropriate choice, or they feel a need to move elsewhere. We need to figure out how and when we can do that. We are currently in the Medicare Advantage open enrollment period, which gives the individual an opportunity to go back to original Medicare, pick up a D plan, and possibly a supplement as well. That's the catch with OEP. We can't really market it, and it is mostly a program dedicated for MA switches, either from one MA plan to another, be it with drug coverage or not, or an opportunity to drop the MA or MAPD coverage and go back to original and pick up a Medicare Part D plan should they choose to do so, and gives us the opportunity to examine choices within the Medicare Supplement arena to see what might be appropriate for them in that circumstance as well. So it isn't a program that gives them an opportunity to pick up drug coverage now. It's not an extension of AEP. It is only if they have those coverages in place. The only circumstance where we see where someone can pick up drug coverage during OEP is if they have an MA-only plan and they're switching to an MAPD plan, which is not the topic of today's discussion, but a point of clarity for you. That SEP chart, well, there's a ton of standard SEPs that we have to look at and consider if a person can move into a Medicare Supplement program. And there are certain programs within that area that give us the opportunity to do so. They move out of a service area. They have an opportunity because of LIS to change coverages, and that includes moving back to original Medicare and picking up D if it's in a difference if it's integrated into their MAPD plan. Some different things that can come into play that can help you recognize the ability of a person to change their coverage now. One of those includes a SEP for different weather circumstances that we encountered during 2020. Pardon me? That's what happens when your hands go a little crazy. Drop the phone here. But it also gives you the opportunity to look into the different areas. This will come as part of the follow-up to you as well. There's a lot of talk, of course, about the pandemic and the recent executive order that's signed by the new president that gives a person an SEP based on COVID circumstances. However, that executive order with that COVID SEP is designed for the marketplace plans, the under 65 programs, commonly referred to as Obamacare. The SEP for Medicare Advantage plans has expired, so don't go worrying about that. Why do we talk so much about these SEPs? Well, because most people during the annual election period, instead of examining their coverages and looking for clarity as to their plan choices, more than half of them don't do it. 57% of them don't do it. And so we have a grand opportunity with half of the people who are on Medicare in a different type of program or not, haven't examined their choices. So are going in with a portfolio approach and offering them choices, including a evaluation of their drug usage, can be a great opportunity for us. And a lot of the folks that don't examine their coverage, well, they've got some different challenges. Sometimes they're older, sometimes they're influenced by their pocketbook. Sometimes they have a challenge with education, or if they're in poor or fair health, they don't look at it. So some of these categories give us an idea as to whether or not some of the folks that we visit with would be a viable prospect for Medicare Supplements. You've got to afford the coverage month over month and the coverage for the prescription drugs. So we need to make certain that we are looking at the pocketbook option or lack of as well. And about a third of the population don't understand what's out there anyway. So our knowledge of the different programs and our ability to describe the options, discover for them some of the programs that may well better fit their situation can make a big difference for us as well. And a lot of people will say, well, gee, they've got Medicare.gov and they got the plan finder. Well, most of them don't use it. And with some of the electronic tools that you have available to you for Medicare Supplement and detail on the Medicare standalone Part D programs, give you an opportunity to help folks push past that piece of material that's available to them that they're not using, because you're clarifying it for them, and in many cases using the material to help them understand what is out there. We need to reference, of course, MACRA as a bit of a fallback too, even though this came into play a little over a year ago, some folks are still a bit confused as to what plans they can offer whom in the Medicare supplement market. Keep in mind that basically we have two categories of Medicare beneficiaries now: the folks that were on Medicare before January 1st of 2020 and those that became eligible afterwards. This gives us, well, a bit of a choice that we need to do when we talk to them, because the Medicare plans F, C, and the high deductible plan F aren't available to the new to Medicare folks after 1/1/20. So we need to make certain that we are also describing a program that a person can actually access. So the folks that are active in the turning 65 market need to be aware that C and F plans are not available to those newly eligible. This chart helps with that. And this will actually, as it's part of the presentation, be available to you, because it speaks to the fact of the two programs that are only available to those who have C and F and were eligible for it before 1/1/20. Keep in mind, that doesn't mean that you can't move a person who has a Plan F to a different Plan F, because that option is still available to them. And it's curious to see how some of the claims history and the marketing emphasis by some of the different Medicare supplement programs chase that business as well. And they would, because in most cases it's underwritten and a more profitable line of business. But this can be helpful for us in both understanding what we can offer and the difference between the plans that are available to the folks that we're visiting with. A little bit of background on some of the Medicare supplement programs. We'll go through this quickly because it'll be kind of a refresher for many of you, but also some rudimentary information that we need for folks who haven't been offering Medicare supplement plans. And this is to start with how we come up with, or how the carriers come up with, the Medigap pricing. And these programs can be priced or rated in three different ways. They can be community rating, have a community rating, which is no age rated. This is not a very common way of offering the programs now. You still see it with some of them in certain markets. You see more of folks that are issue age rated, where they are maintaining a rate based on the age they had as they came in to the program that they select. And then, of course, the folks that are attained age rated, and those are the folks that see increases based on their age moving forward. It's also important to note the differences between open enrollment and guarantee issue for Medicare supplements. And CMS has defined that difference for us, where the open enrollment's a one-time only 6-month period, where the law allows the individual to buy a Medigap policy with whatever programs available in the domiciled state, wherever they live. It starts in the first month when they're covered under Part B and 65 or older, and during this period, they can't be denied a Medigap policy or charged more due to past or present health circumstances. And some states have additional open enrollment rights under state law, sometimes birthday rules in certain states, other anniversary choices where there's not underwriting involved as well. Those are more exceptions to the rule, but it's important for us to note as well, during open enrollment, the commissions on Medicare supplements can vary as well. Different companies offer them as an aberration of some of their current commission strategies. And of course, GI periods, the guarantee issue rights, those are circumstances that an individual, if they lose certain other health coverages, or where the insurance companies are required by law to offer a Medigap policy, these are periods too where an insurance company can't deny the applicant a Medigap policy or place conditions on it, such as prior conditions where they exclude a condition for a period of time for pre-existing conditions, or can't rate up, can't charge more for that Medigap policy. So these are important things to know, especially during different times of the year in different states or nationally on the open enrollment program. So it's important to note as well that there are underwriting circumstances that come into play in most areas if a person doesn't have an open enrollment or guarantee issue period. It's also important to note that there may be Medicare Select programs available in certain markets, and if a person picked one of these, they have the right within 12 months to change and go back to a standard Medigap policy. What's a Medigap Select policy? In most circumstances, these are programs that are built much like a standard Medicare Supplement, a standard Medigap policy, but in order for a person to get full benefit for their hospitalization, it's a quasi-network of those hospitals that are involved with that for planned procedures. There are a number of reasons why a person would switch Medigap policies. Sometimes the individual may feel they are paying for benefits they don't need, or they need benefits, more benefits than what they had before, and they have a policy in place where they're happy with the benefit structure, but they want to change the insurance carrier. And of course, even if the Medigap policy has the right benefits, they may be looking for a different type of policy that would cost them less than what they are currently being charged with their current coverage. And you'll see the tools that we have in play that can help you in those circumstances. A person can switch during different time periods, obviously, with Medigap policies. It's important to note that it's a solid recommendation that if a person is changing, they need to have their new policy in place before they cancel their old coverage. And the new policy comes with a 30-day free look where they can decide, on second thought, I got a little buyer's remorse here. I want to go back to my old MedSup company. I'll go back and pay the premiums for each just to make certain that I am comfortable with what I've got and then drop it later. So it gives us some of the talking points we need to make certain that our folks know, our applicants know, that there are certain guidelines they should follow when it comes to changing their policies. There are different health programs out there that are not Medigap supplements, not standard Medicare supplement programs. And these include, these include the Medicare Advantage programs, the Medicare prescription drug plans, Medicaid itself, the different employer or union plans, including the federal insurance program, the FEHBP. TRICARE is not a Medicare supplement. The veterans benefits are not. Long-term care policies are not. And then some of the Indian health, tribal or urban Indian health plans are not Medigap policies as well. And referring to any of these as a Medigap policy or a Medicare supplement program is out of compliance. Some of the things that we see by the number of folks that are in Medigap policies, how they are laid out by sex and location and age, what we see is the gender distribution. There's 56% of the women that are Medigap policy members or holders, or 44% are men. Why is that? My personal opinion is, well, gee, women live longer. So the longer that people can hang into the programs as well. And we then see the split of the different programs based on all of Medicare, the folks that are in Medigap, and then the different settings, the urban or rural settings, and how that rolls. And we see the strongest penetration in that area is between 65 and 70. Once people, my opinion, reach the age of 75, some of them have depleted their resources and they're looking for something less expensive. And then, of course, the folks that are under 65, because of the limited options they have in most areas for a Medicare supplement, it's not really a viable choice for them. You also look at how these people pick a coverage based on what's in their pocketbook. And you'll see that the higher income individuals tend to be the folks that are deeper penetrated by the Medicare supplement programs. Well, they can afford it, even past the different ages that we looked at in the past. And this gives us an information based on some of the last detail available to us. This comes out of a 2020 report. The last piece of data in it is 2018, and we see the different plan choices that come into play of the companies that are offering the different programs. Because keep in mind, just because an insurance company operates as a Medicare supplement provider in a state They do not have to make available all of the plan types. There are certain requirements, but you'll see that generally the programs that are out there tend to be the more popular plan choices, obviously. And you'll see, too, that some states, the Medicare Supplement programs are a higher penetration in certain states. And you'll see in many circumstances that that involves some of the more rural areas where there may not be a Medicare Advantage alternative that is feasible for that individual based on past history, or we're seeing a flip of some of that moving forward, where many of the Medicare Advantage carriers are offering a greater choice of plans in those areas as well. So we'll see some changes, I think, in this in later documentation. The market is dominated by some of the big boys. You'll see United Health Group with their AERP product, Mutual of Omaha, CVS Group, that's the Aetna programs, HCSC, Blue Cross organization in 5 states, the Anthem programs, Cigna come into play, CNO, and Humana. You'll see also a proliferation of plans by some of the lesser known companies that compete for market share, many times based on price. Some of the things that help us as well when we offer Medicare supplement plans is being aware of what isn't covered by Medicare or Medicare with a Medicare supplement. This is based off of information out of the Medicare and You book. I usually have that in there. It's page 49 of that booklet, which tells the person that you're visiting with that, hey, prescription drugs aren't covered as part of a Medicare supplement program unless they're grandfathered into one of the old Plan J's, which is not, by the way, creditable coverage. So that person needs additional programs or additional coverage for prescription drugs. And in many circumstances, because Medicare itself limits coverage outside the United States, most of the programs, or many of the programs, I should say, with Medicare supplements, echo that because they base their payment on what Medicare pays. Some of them may have limited coverage for medical expenses outside the United States, but we need to make certain we know exactly what those are and what we're talking about when we're discussing the programs, be it with a person who travels or not. Long and short-term care programs are not covered by MedSups either, and neither are many of the ancillary benefits. There are an increasing number of Medicare supplement plans that will offer additional benefits outside of the standardized benefits that come by plan type, but these are generally discount programs and give you an opportunity to explore additional coverage for your individual in the area of dental, vision, and hearing. That is a recommended practice in any type of sales circumstance, obviously cross-selling, because the more policies you have in a house, it increases your persistency, your retention based on the number of programs that are in the program in that household. And it's important to note that this is based on you as an insurance agent, not the actual offerings, because those offerings can be with different companies. They just have to be with the same agent to really see that drive for additional retention. So as we look at the things we can do based on that history and how we can sell Medicare supplements, it's important to note once again up front the macro legislation and what policies are available for our prospects and clients, but also be aware of the fact that because of, well, and the growing circumstances in spite of, many of the folks we're talking with are becoming much more increasingly digital savvy. And that helps us as agents as well, because if we have the proper tools, we can do a whole bunch of this electronically, virtually, keep ourselves and our prospect base healthy and do what is right for them. But keep in mind that the tools that are out there are much more valuable for you on an electronic basis, because the folks you're talking to are becoming increasingly accustomed to that type of approach. We're seeing it with the healthcare delivery itself, where many of the doctor visits, even some of the pre-work for hospitals and dentistry, are all done electronically. all visited in that fashion. So it gives us the opportunity to be aware of the choices that we have to help people enroll in the programs. And if they prefer an in-person visit and you can do it within the standards that are there, obviously, much as what we've done status quo for many of us in the past, but you also need to have the tools and the ability to flip to a virtual presentation, and those are available to you more commonly than you might think. Because remember, however we do this, we got to do it in a fashion where we're not putting all our eggs in one basket, and we realize that not one size fits all. So we need to discuss a general description of the Medicare arena itself, and then the choices that they have within that area, even including the different plan types that are available with Medicare Supplements, which is a strong recommendation for delineating between those plan choices, much as that chart that we've seen a couple of times tells us here through today's presentation. One of the tools we make available to our contracted agents is our MedicareCENTER program, which is an electronic chassis in order to examine and distribute information about their health plan choices. So this comes without charge to our agents. It includes a robust CRM for you to use within the program. It's a singular logon. It has two different types of quoting engines that will give us an opportunity to examine all their choices, and it gives us also an opportunity to look at some of the options that are available to them based on how penetration is, certain different things of that ilk. But it also gives us a quoting tool for our Medicare Supplements, which gives you an opportunity to go in and examine different plan choices for them in the Medicare arena. It can give you detail on penetration on Medicare Advantage and PDP programs, so you know what you're either up against or an offering in that area. It gives you also an opportunity to go in and quote people on different Medicare supplement plans available to them through you. That is a strong consideration because it not only gives you an idea as to, gee, these are the competitive programs in my market, I need to adjust some of my contracting portfolio or add to it. It also gives us then a means of offering a complimentary Medicare supplement review to our prospects and clients. And we can do it live. We can do it basically remotely as well. We can do it also on a circumstance where we download that data and send it to them. So it gives us a great opportunity to go in and see what the different plan choices are. It's a very simple program to offer. It is based on some really basic information about our prospects that we can go in and see the rate available to them in their area at their age, whether or not they use tobacco, and whether they're male or female. We need to make certain that we are looking at the effective date that is pertinent to that individual, because there may be rate increases on some of the different programs that we're unaware of as we quote. And if we're doing it before some of those take place and that change in rate is effective before the person is effective in the MedSup program, it could cause us some challenges as to the validity of the rate that we are offering. It also gives us an opportunity to e-enroll right through that tool with many of these programs. Some of them are directed to the enrollment tool of the carrier, but it gives you then that information and that pathway to follow. Some through an electronic process right through this piece of information. It also gives you an opportunity to store your compliance documents. And I know in the Medicare supplement world, a scope of appointment is not required in order to discuss that product. The challenge that you have is, well, many times when you talk about Medicare supplements, you're going to talk about other programs. It's nice to have that legality out of the way. You can still do both an explanation of them by having that document ahead of time. It also gives you kind of a track to cross-sell because it does list DVH and other programs, dental vision, hearing, and other programs. This allows you to collect that electronically and store it for that 10-year period. Gee, John, you talked a lot there. Why do I care? I'm just doing med subs. A whole bunch of them are going to ask you questions about PDP And sometimes you want to make certain you service that area and close the door for a different agent that may be looking into or using PDP as an entree into your client's household. It's there for you to use. It's there for you to have it stored compliantly for that 10-year period and make certain that we take care of you in that fashion, but also set up additional sales talk. So if we go into a live demo of that particular program, bear with me a moment. Let's actually use, pardon me. Here we go. Let's look at this. Oops. See, John. Let's go right into that program. I've already got my information in there. This program is, of course, part of the MedicareCENTER programs available to you without cost as a contracted agent with us. We grant you access to these programs, and it then gives you an opportunity to go in and do what I've just talked about for the last 5 minutes. We go into the quoting tool and pick out some of the different information. It gives us different disclaimer information so we can remain up to date, kind of a reminder of these. This is talking, of course, about MACRA. So let's do some basic things in here and show you exactly how this works. Let's pick a North Dallas zip code. Let's look at a person who is not turning 65, but a couple of years into it where they may have seen a rate increase and are looking for additional coverage. We'll stick with looking at a female. Since they're 67, they will qualify for a Plan F. They're looking for a better price. At this point in time, we haven't discussed any of the other plan options that are available to them, such as a G or possibly an N plan or one of the other programs that are available. This lady is single, but we do have a household discount available, which can really be a decision maker for couples in a household, because some of those can be substantial, from 7 to 14, 15%, depending upon the carrier. So we'll do a literally quick thing. What have I done here? I've looked at a quote. I'm getting a quote without having an effective date. So exactly what I told you not to do. So let's go in. Oops. Pardon me. This is telling us of some of the additional EAPs that are available. We're going to make certain that we put it at, okay, they're looking at the first of the month. And let's redo this. Thinking. And in this particular circumstance, it hasn't affected some of the rates here, but it gives you then the background as to the different programs that are available for that individual in that zip code and the premiums that are associated with them. If we add in market analysis, this tells us of the standardized rate increases they can anticipate based on changes of age, some of the past history of increase on top of that age difference, and it gives you an idea of the market share that is enjoyed by that particular carrier. And that is a great way for you to use as a discussion point these different market data pieces, because the folks that have, or the carriers out there that have a big book of business can absorb different rates differently, so you can see different changes in that come into play. You can also help the people recognize there will be different rate increases based on the age differences or as they age. And you'll see, too, how some of these companies stack up against each other when it comes to not only rate, but market share and what we can see as increased history. It's interesting to note that this gives us then the data we need to discuss different choices that they have and the programs that we need as part of our portfolio as well. It's also interesting to see that we can pull in different health underwriting filters as well, and that can really make a difference for us when we're dealing with a person who needs to be underwritten and has different health circumstances. Some companies will look at different health challenges or health conditions differently as to whether or not they accept them or not, or at what rate they will accept that individual. So it's a great tool for us to go in there and say, hey, you're looking for a program with Mutual of Omaha because you loved Wild Kingdom and Lyle Perkins and the whole commercial of, hey, it's a Timex, it takes a licking and keeps on ticking. I'm showing you how old I am, I guess. But it gives us then the information we need for the different programs. And there are certain carriers that people will ask for based on their comfort level with having coverage with that carrier in the past. And so there are certain markets where a program may not be the least expensive, but is the one they're most comfortable with, the one they want to buy. And as long as you go through and you detail some of the differences in premium and make them aware of the choices they have, hey, they're the ones buying it. We have to make certain that we can accommodate certain requests as well. So it's interesting to see these different programs and how they stack up, but it gives us then that detail that we can use to examine the choices. You can download this document into a PDF. It's a nice, clean-looking document that you can share with your prospect or client. If you download it in an Excel format, it'll lay out all the carriers in this analysis and all of the plan choices that they have. So it gives you a great resource to use as talking points should you be in an area where the internet is not as healthy as it needs to be and you can't do some things live. As a reference point in that discussion, it gives you also a piece to discuss the different plan choices they have within the Medicare Supplement arena. Why an F versus a G versus an N or whatever, and it gives you that detail. You can do that same thing with the tool as well by going into and changing the plan type here. So if you wanted to look at, instead of the F plan, whoops, hit the button one too many times, and the ever popular in this circumstance now, the G program, it gives you an ability to re-rate. So we see Manhattan Life here as the least expensive program in this offering as an F, and it still remains the least expensive in the G. It drops their premium at $23 per month, which over a, some of these reminders, it gives you then the savings of that person being liable for their Part B deductible. That's basically the difference between an F and a G oversimplified, and that under $200 deductible, I think it's what, $196 this year, they can more than afford that coverage. There are individuals that say, hey, I've got an F, I don't want to have to worry about anything, including the deductibles. We have to be cognizant of that choice, but it does help to make people aware of that potential savings as well. Some of the things that you get from us additionally, in addition to the tool that we demonstrated as well, is a way to contract with multiple carriers quickly. This software program, Insurance Bay, gives you the ability to set up an agent profile, maintain it, answer questions that you commonly see in contracts, put in your E&O, your licensure information, and you're able then to contract with multiple carriers by just clicking them off one at a time. Gee, I saw where I need that Manhattan Life product. You can do that, and it'll autofill the contract for you. There are certain carriers that don't abide by this. Come to think of it, I think Manhattan Life is one of them, where we have to use a different electronic process to contract. But this then also gives you the ability to pick up some ancillary coverages, dental, vision, hearing programs, hospital indemnity plans, critical illness cancer plans, additional programs in the Medicare health arena, and other areas as well by just clicking on a company. We also make available to you discounted E&O for qualified agents. What makes you qualified? Well, you got a contract with us. This is a standalone program that you own. So it will cover you regardless of whom you contract through for different products that require E&O. And most of them in the insurance world now do. Fairly inexpensive, but it covers you across the board and you don't have to worry about, well, gee, I got to add it to a blankety, with this hierarchy for this program. What are you doing for the rest? We want to make certain that we protect you in those circumstances, and also extend that same courtesy in maintaining your licensure, where we, through our association with WebCE, offer a discounted continuing education credits to keep your license in play. We also give you an opportunity to add to your own benefit package by the use of a modified guarantee issue DI program, disability income program, for yourself, where you share in the commission of that product and add to your own benefit package and protect your ability to earn. Much as where today's presentation is being recorded, we have past presentations in our library of educational opportunities that include not just conceptual presentations such as today, talking about Med Subs or Medicare Advantage, PDP programs, wherever it happens to be in the type of program like that, DVH, whatever. But there are also different marketing programs in there that give you hints and tips on how to get in front of folks in order to offer the programs that you contract with and that you're looking to make available to your prospect population. I cannot emphasize enough the value of that electronic tool, the MedicareCENTER program that's available to you without cost, because it can be your entree into a house by offering the Medicare Supplement reviews. It gives you the ability to protect yourself on a compliance basis, store the information you need, and act as a CRM for you as well, all through a singular login. Great program for you to use. It includes, of course, that electronic tool that we just discussed and briefly demonstrated, and we also make available to you an area where all of the carrier incentive programs are in a singular place. I've actually run across some folks we contract with that emphasize the fact we need to make you aware of where this is, because sometimes those trips and incentives can be a difference maker to you as to what carrier you want to emphasize when the benefits are all structured and the premiums are really similar. You can see some really cool incentives where many of the Medicare Supplement programs are offering what they're calling a marketing allowance, a per application bonus of sorts based on applications taken during a month or quarter or a year. And those can make a big difference for you, and they can also help you qualify if the carrier offers a trip as well. Both of these incentives also help you qualify for the Premier Incentive programs, which this past year was supposed to be a cruise. We know what happened with cruises in 2020, but it turned into a cash opportunity for those who qualified. $4,000 for a lot of the folks. This gives you an idea on how you qualify for our incentive programs based on the writings that you do with our organization, with our contracted carriers. You'll see that Medicare Advantage and PDP programs are not included in that because the compensation for those programs, max compensation, is scheduled by the government, and including incentive trips, well, that won't work with those regulations. Some of the things that we can do to help get you in front of people, well, if you're a friend of Ma Bell and you like to cold call, we can get your contact list butted up against do not call at a very reasonable rate. Reasonable rate in some circumstances can be no charge to help you smile and dial for a certain population. Many folks automatically default to a 65-year-old to do that. T65 is a great market. It's just very highly competitive. So many people will use that contact list for a person that's 67 that have seen some of the price increases and maybe price shopping. That gives you the opportunity to reach out to an individual who's looking for help and not bombarded like many of the T65s are, but also gives you an opportunity then to use that tool, offer that complimentary Medicare Supplement review, quote, apples to apples or apples to oranges with changing different plan types. We do also offer information on how to maximize the value of community-based marketing programs. This will include retail marketing, such programs that are offered by certain carriers or through the Walmart program. Medicare Supplements are a viable option in those circumstances, but also reaching out to different centers of influence in the community. When I speak of faith-based opportunities, this is an opportunity to access congregations through faith-based organizations. We actually have a webinar on that tomorrow. But it gives you then an opportunity to discuss Medicare supplement programs, explain the differences between the plan types. We actually have approved presentations for that, and you can do that live or virtual. Many of these organizations have been offering services virtually and are reaching out to their population. And should they find value in what you're offering, and that depends upon you and your presentation, they may allow you access to their congregations through that virtual presentation. And there are providers in the community that aren't part of a network, and they need help with maintaining their payer mix, maintaining the patients that are with them, and sometimes utilizing a Medicare supplement program to explain their choices can be of great help to them. And there are folks that actually, providers that actually contract with and are part of a network for an MA program that may have individuals where an MA program is not the appropriate decision for that individual because of network restrictions and some of the specialists that may be involved. So it gives you an opportunity to use community-based programs to market. Sometimes the carriers will generate prospects for you as well. We see this more in the Medicare Advantage world, where you may see what I call Lazarus leads, leads that have been worked by internals perhaps, no contact or no success, and make them available to the broker community. Or there may be innovative marketing support programs that many of the companies offer that can help you get in front of individuals as well. We do have internet lead programs for Medicare Supplement and direct mail support in the arena of the health programs, because there are two programs that you can qualify for, one in the Medicare and health arena and the other in final expense, where based on production, you deeply discount the costs of those programs. So writing business consistently with our organization can drive down your mailing cost and give you the opportunity to do that consistently. Because keep in mind, mailing, direct mail is much like your exercise programs. If you do it once or twice, you feel the pain, you don't see a lot of the results. You do it consistently, that's where you see the value of the program and the benefit that it delivers for you. We do offer these through preferred lead vendors, and we do so because we want to make certain that the correspondence that's going out there is compliant. We've seen some advertisements on some of the social media platforms and on some of the direct mail that speaks to OEP, and that, of course, is a non-compliant outreach, and we want to make certain that we are protecting you in that area. Some of the things that we see as well were for folks that, well, gee, even at $230, I can't really afford that to direct my own mail campaign. One of the advantages of a direct mail campaign you control is the freshness of that lead, but we do also offer leads to you based on response only. And these are perhaps a little bit less fresh because the direct mail, you're notified as soon as that response comes in. These may be a little older than that, but it gives you the opportunity to outreach to someone who's raised their hand on a different product and do so at a cost that may be more amenable to your budget at present. There's two different programs that we use in that area, so be aware of that and how it may help you in pursuing your preferred end result of a sale. When we talk about the Facebook leads, there are programs out there that we do that are generated through Facebook, through a third-party vendor for both final expense. It says here Medicare leads. Keep in mind that generally applies to Medicare supplement programs. We do all this simply because we want the opportunity to work with you. We want your business. We want to demonstrate to you that we're bringing you the value of not only the tools that are available for you to help pursue this business and close this business and do so compliantly, but it also gives us the opportunity to look at additional programs that may influence more revenue coming into you and your agency. So all that said and done, if you are interested in detail specific to your market, it's a decision you make to become involved with this. If you've got a contract with us in the Medicare Supplement or Medicare Advantage world, you get access to all those systems. You make it part of your overall marketing strategy. you work with your premier marketer to become accustomed to those systems, or if you're the individual that likes to do it themselves, obviously it's there for you. But having that data then and incorporating it into the marketing plan that you have in play can be very successful for you. So all that said and done, I want to check the questions that we may have here. Bear with me. Someone's talking about had challenges with access to the webinar. We'll make certain that they have the recording. CRM is the customer database, so it's the program that you have in play for your prospects and clients that gives detail on those individuals so you can go back and work them properly. The E&O slide, actually taking a snapshot of that. Bear with me for a moment, Cynthia. Let's go back to that. But it's also available on our website, which I think would be easiest for you. Go into premiersmi.com. They have a link to it, but here's also the direct link so you can take a snapshot of that, Cynthia, which is the 360 Coverage Pros, which is the company we use for that E&O coverage. So all that said and done, we're just a couple minutes under the hour. I want to thank you for the investment of time with us here today. We realize that your time is your most precious commodity. We appreciate you spending and investing that with us here today. We also want to thank the folks that are currently contracted with us and working with us for that relationship and your business. It is highly appreciated. We ask that you watch for the follow-up to today's presentation, where you'll see much of the data sources that we reference through the course of the presentation and information on these programs. And you can do so by responding to that email or calling 1-800-365-8208 and speaking with your marketer. If you don't have someone you're working with there, dial in and we'll make certain someone takes care of you. And of course, you can go to our website at premiersmi.com and look at the information. There's also a jot form in there that you can use to request that someone contact you as well. So all that said and done, wait a minute here, we got another question. What's the difference between enrolling UHC through Lean or through MedicareCENTER? There's a couple of different things. If you're doing the assessments, the health assessments for any of the carriers, including United Healthcare, in order to be paid that fee or compensation for handling that assessment, you got to use the carrier's enrollment platform. So Lean or Ascend or whatever it may happen to be. With this, it's basically directing you through to the enrollment centers, and it gives you the opportunity then to viably compare different programs using those systems. So a side-by-side comparison. That's a compliant piece and advantage to using those programs. Let's see. I think we've got all the questions covered here then. So I want to thank you once again for the time that you spent with us. We look forward to visiting with you in the near future. And until we're able to do so, I wish you good selling. Thanks so much. Stay warm, and we'll talk to you soon.